Now, Dr. Daniel Messelken will next talk on ethical issues regarding humanitarian responses in disasters and armed conflicts. He is an ethics teacher and leader, Center for Military Medical Ethics, University of Zurich, as academic associate on military medical ethics, Center for Ethics, University of Zurich. Member, Board of Directors, International Society for Military Ethics in Europe. Head, Ethics Teacher, International Committee of Military Medicine Center of Reference for Education on International Humanitarian Laws and Ethics, Dr. Daniel Messelken.
So I'm working at the Zurich Center for Military Medical Ethics, which is a research center based at the University of Zurich. And it is part of the Swiss Center of Competence for Military and Disaster Medicine and financed by the Swiss Armed Forces Medical Services Directorate. We also organize courses and workshops on military medical ethics and ethics in disaster settings in cooperation with the Swiss Armed Forces and the International Committee of Military Medicine. And you can find more information about this on the websites listed on this slide if you want. And also, I am financed by the Swiss Armed Forces. I would like to say that that the views and opinions contained in these presentations are my own, and they may not be construed as official or as reflecting the positions of either the Armed Forces of Switzerland or the University of Zurich. Now, what I would like to do today is to explain you the importance of bioethics and medical ethics in emergency situations, and also look at what are the specific ethical challenges for healthcare personnel during armed conflict and disasters, and also have a short look at how does ordinary medical ethics translate to these rather exceptional contexts. So I would like to create some awareness for medical ethics in emergency situations and to introduce you to some typical ethical challenges of disasters and conflicts, namely resource scarcity, communication barriers, and the risk to life and well-being of healthcare personnel as an ethical issue as well. But before I start, I would like to briefly look at the context that we're talking about. And we've seen already a lot of this in the previous presentations, which I like very much, and I learned a lot from them as well. So what are the important features with regard to ethics of the situations in which humanitarian responses most often take place? So when we're talking about armed conflict and war, it's of course the use of force, the use of military force on a large scale. When we're talking about disasters, we're talking about natural or man-made disasters with catastrophic effects, which basically and eventually overwhelm the community, which can no longer cope on its own. And then we have what we could call something like an umbrella term, the term of complex emergency, which is an umbrella term for different situations, and that summarizes well the main challenge. And the main challenge is it's a difficult political and security environment with disrupted livelihoods. And so if one practices medicine in these contexts, we're talking about medical ethics with an added layer of complexity, which is created by the context. And this context can raise, as I said, several ethical issues. And the first issue that I would like to talk about is access to healthcare and triage. And of course, the question, if we have a scarcity of resources, so not enough resources compared to what we need, then who is admitted to medical treatment and how are resources distributed fairly in a fair manner? Now, as I said, scarcity is a relative concept, so it's always relative to a need, so we don't have enough to what we need, but it can also be relative to what we are used to. So for example, during missions, if you come from a richer country and you go to a poorer country, you have less than you're used to. And it can also be relative to what is normal. So every country or every community has a certain level of normal resources. And so it can have a temporary shortage due to war, disasters, or whatever. So we have less resources that are needed to treat according to the standards that we are used to. Now, how can we deal, or how can one deal with resource scarcity? First thing, of course, is triage. And it was just explained much better than I can by the previous speaker. So triage happens on the ground. It should happen so that it's ethically legitimate according to medical criteria only. It should have, as the main reasons or the main aims, it should have efficiency, so save as many lives as possible, but also fairness, and that's very important. So equals should be treated equally, and there should be no discrimination. So it should not matter whether you're a man or woman, whether you're black or white, whether you're from the country or from a different country, and so on and so forth. Now, a different way to answer the question, who is admitted to treatment, and that's not happening so much on the ground, but rather on a training planning level, are so-called medical rules of eligibility. These are decisions taken on a higher level during mostly military planning, and quite common in military missions when you expect to have more victims than you can treat. And the main ethical issue in these medical rules of eligibility is, from my perspective, whether non-medical criteria should play and can play a role. So what you find very commonly in those medical rules of eligibility is, for example, that local population can only be treated in certain contexts. So for example, when they are direct victims of the use of force of the armed forces, but not when they have a car accident. And this can create a lot of ethical issues for doctors that are working in these contexts, also for military doctors, of course. And then lastly, we kind of have to accept that when there are not enough resources, so when we have to use triage or other criteria to determine who is admitted to medical treatment, there will be dilemmas and there will be so-called tragic choices, because not everybody in need can receive an optimal treatment. And this is something that, well, eventually one has to live with in these situations. One should know about this from the start. Another ethical issue related to resource scarcity, but also to other contextual constraints, are so-called altered levels of care. So the question here is not whether care can provide it, but on what level medical care can be provided. And again, we're talking about scarcity, so we have less than normal, less than needed to uphold normal standards. And then the question is, what level of care can be provided to those admitted in the first place? And ethical challenges that we can find in these situations are, for example, so-called lowered or altered standards of care. So the so-called gold standard cannot be upheld, and we have to live with lower standards or with altered standards. And this would be difficult to justify in a normal environment, difficult to justify from an ethical perspective. But what you're doing when you have not enough resources is probably to use less resources on one patient to do better for more patients. And these kind of lowered levels of care are, of course, suboptimal care, can be justified in settings when there's not enough for everybody. A different challenge in contexts like this is treatment beyond the own competences. And common examples for this is, for example, pediatric treatments or the treatment of children, or emergency obstetrics, when you're just not a specialist in these fields. So what do you do if a child is brought to you, so a very young child, maybe a 6-month-old child or so, and you're usually working with, with grown-up people? So do you treat this child, and what treatment do you provide? What do you do if a woman is brought to you that obviously needs help during giving birth, maybe even a cesarean? Sorry, but this is not among your specialties. So these are ethical challenges, because the problem then is whether you do help at all, or do you try to do your best, still knowing that this is not something that you usually are trained to do. And what is happening in these situations is, of course, we have to live with compromises. So we have to try to achieve the best possible result under the circumstances. And this has to be a sincere and a realistic evaluation. So you cannot just say, well, I'm going to be the hero and operate on this woman, And in the end, she will die because you didn't know what you were doing. So this is a real ethical challenge. Still, compromises can be acceptable if no better outcome was possible. And they can be ethically acceptable if they are clearly communicated beforehand to the patients and or the relatives if the patient, for example, cannot speak for themselves. Speaking of communication, this would be another challenge in disaster settings. So communication and informed consent can be challenged in disaster settings and humanitarian missions because of language or cultural barriers on the one hand, but also because of time pressure. And the ethical question is, how can informed consent and patient autonomy be upheld in such contexts? And so there are two very obvious barriers for communications. The one is language. So maybe you don't speak the language of the local population. And of course, during disasters and large-scale mass-scale situations, there will be lots of unconscious patients and no relatives, etc., will be available. Because there's chaos. Or when you look at the bombing in a cafe, maybe there's no relatives close to the cafe, so you cannot contact people and not ask what would be the informed consent of the patient. And then, of course, there are other barriers to communication and consent, and they can be different understanding of what informed consent means. So I know that there are cultures where it's much more about individual consent, and then there are other cultures where it's much more about the consent of the family, and both are equally valid from an ethical perspective. Not the one is not better than the other, but if you come from one of the concepts, then it may be difficult to understand the other concept. Then another example of cultural barriers or of problem with informed consent is the treatment of women by male healthcare personnel in some cultures. There are cultures where it's not allowed for male healthcare personnel to treat women. And this can be a problem in emergency situations when only one doctor is available, and this is a male doctor. So if you are this male doctor, should you operate nevertheless? Should you treat? And what should you do? So this is, of course, a problem for informed consent as well. Last but not least, there's time pressure, of course. You're working in an emergency and there are other patients waiting. So spending a lot of time on the question of informed consent may seem to be a waste of time, may seem to be not the right thing to do. And it could be that it's, if there's a patient that is unconscious and needs help, you will operate anyway without informed consent and assume that the person wants to have their life saved. And this is a very good assumption, I think. But still, what I wanted to show with this slide is that informed consent and disaster and emergency settings is, of course, a big challenge. And I think I haven't even talked about documentation of informed consent and so on, because if you have language barriers and so on, and you have time pressure, then the documentation of informed consent, as we're used to in normal clinical environments, will, of course, be maybe even impossible to do. So with this, I would like to look at a last and a fourth ethical challenge, and that is the one of risk to own life and the well-being of healthcare personnel themselves. And I think the trigger for this is, of course, that are risk factors of the context. When working during a conflict, during disasters, with infectious diseases and so on, there's, of course, the ethical question of how much and what kind of risk healthcare personnel should be ready to face. And here we can be talking about at least two kinds of harm that they risk to face. So one is bodily harm. For example, in conflicts, as we have also seen with the first very impressive presentation, there's lots of direct attacks against healthcare personnel in latest wars, or we are talking about collateral damage. There is, as the speaker from Israel reminded us, there can be secondary attacks to first attacks. And so there's just the problem of working in a conflict area. Another example of bodily harm is, of course, working with infectious diseases, namely of getting infected themselves. Now, of course, you can protect yourself, and we've all learned how to protect ourselves basically against infection with COVID. But when you're talking about other infectious diseases like Ebola and so on, it can be very difficult to protect oneself from infection. And the problem is that healthcare personnel are, of course, not per se obligated to take huge risks, but you could rather think of an analogy to a firefighter. So we would accept from a firefighter to help people get out of a building burning. Unless the building is about to collapse, then we don't accept the firefighter to go in there and get killed. So you have to accept a certain risk, but not a complete risk. And then, of course, we could also be talking about mental harm, so-called moral injury. So when you're witnessing things that go against your ethics, we can talk about post-traumatic stress disorders and burnout and so on. And the question whether healthcare personnel should be obligated to take these risks, or obligated from an ethical perspective, is not an easy one to answer. And I think what does play a role here is whether they are military or civilian healthcare personnel, what the area of specialization is. So for example, someone who has specialized in infectious diseases, we maybe would more expect to continue working with patients who have infectious diseases than someone who is specialized as an eye doctor, for example. And then there can be obligations to third parties, like, for example, a family, that may reduce your ethical obligation to take huge risks. Now, if I should recommend you one short reading in ethics that everybody should know, then I would recommend this document that's shown on the right side of the screen, and the QR code will give you a direct link to that document. And it's a document called The Ethical Principles of Healthcare in Times Around Conflict and Other Emergencies. It's a document with fundamental principles of medical ethics that has been compiled under the lead of the ICRC from 2013 to 2015, and has been adopted and recommended by important organizations such as the World Health Organization, the World Medical Association, but also the International Committee of Military Medicine, for example. And so this document kind of gives you a common denominator of ethical principles that are applicable during conflicts and emergencies. I've just listed here two of the most important principles. The first one says that the principles during armed conflict remain the same. And the third principle is the well-known principle of humanity, that healthcare personnel should try to alleviate suffering whenever possible. So I think this two-page document with 14 principles is really a good point of departure to get some idea about ethical principles. And with this, I would like to conclude and give some small recommendations. So I think ethics should be considered in all phases of disaster preparedness. So it's important during a preparation and planning phase to create awareness for ethical challenges and also to develop guidelines and principles. Or just to know the guidelines and principles as I have just shown you. Then it's important to educate and train, because personnel needs to be trained in ethical principles and ethical decision-making if they are to apply them well. And this training should address healthcare personnel in the first place, but for example, commanders as well, so that commanders in the military know about the specific obligations of healthcare personnel. And then something that has also been said by previous speakers, it's very important, I think, to debrief after what has happened, to follow up, and to start with the lessons learned process in order to prepare for the next event that will unfortunately will happen one day. So with that, I would like to thank you for your attention and thank you for the opportunity and invitation to speak here. And I'm happy to answer questions later.